pain in your back when you sit, bend forward, or reach for something, maybe driving too, you might be dealing with what's called the lumbar disc herniation. I'm going to tell you all about it. My name's Chris, I'm a physical therapist at Buffalo Rehab Group, and we're here to talk about lumbar disc herniations today. When we talk about what the anatomy actually looks like in the lumbar spine or the low back, we have a couple different things going on. The white stuff here is the bone, or you might hear that as vertebrae, okay? And in between that, the red is what's called the disc. And the disc cushions the space between the two bones. I don't want compression of bone number one on bone number two. I want something nice and cushiony in there to prevent that and to protect everything. The other thing that is important for is you look on the backside and you've got what's called the spinal cord. And the spinal cord has little nerve rootlets that come off the side, just like that. Now, what happens with a disc herniation is when I bend forward, anytime I flex my spine, we call that, I go here, and you can see those nerve roots tend to get compressed between that disc, or that disc fluid pushes out the back and it irritates those nerves. Now, if I get out of what we call flexion or bending forward, pressure relieves. So that is the goal with disc herniations. We don't want to live here where we have pain, we want to live here where there's no compression of the spinal cord nerve rootlets. That's the whole idea, is to offload those discs. So the easiest exercise we have is to offload the disc. It's the easiest place we can go. Now, if sitting down or bending forward or reaching for something, such as this, irritates you, we want to go in the opposite direction, what we call extension. So the easiest exercise you can do is stand up nice and tall, hands on your hips, and all you want to do is bend your low back backwards until you feel a little bit of a pinch. Hold that for a second, and then just return to neutral. And you're doing it again, hold it for a second, and then come back. I always tell patients, pretend that there's a wall in front of you. You don't want to end here, meaning all you want to do is go back like this, and then end in front. Back and forward. You should notice your range of motion tend to increase as you do more, and that pain that you're feeling should slowly reduce as you're going through more of them. Normally I'm telling patients 10 times is a safe bet for this exercise. And if you find you need a little bit more information about disc herniations, or you want to find a program more catered to you, head to buffalorehab.com and we can put you in touch with one of our PTs to best help you.